Dr. Desmond White, how do we know or certain if a particular symptom is caused by medication? It's really quite difficult. Let me explain. I have one patient this morning seeing me. She said that, Dr. White, I have reflux GLD. I've been taking a type of medication called proton pump inhibitor or PPI from you. It works well for my reflux, but I noticed that I've been having more hair loss. So does the medicine that you give me cause hair loss? So this is not an easy question to ascertain the answer. So how do we know if a medicine causes a particular side effect? Actually, we have certain guidelines and principles that are common sense approach. First, the patient shouldn't have the problem before. She takes the medication and problems start. After she stopped the medicine, the problem resolved. When she takes the medicine again, the problem recur. And we have excluded other causes to explain the symptom. And also this drug is well known to cause this particular symptom. So we call it challenge. That means a patient is well, you give him one medication, that's the challenge. After that, a side effect occurs and you remove the drug. We call it the challenge. And after that, the symptom recur, you give them the same medicine again, we call it re-challenge. So challenge, de-challenge, re-challenge. And the same symptom come back up. And we have excluded other causes, and this drug has been well known to cause the same complication in other patients reported in the past. Then we can call it a drug-induced adverse effects, and now we will report it to the relevant authority. In Singapore, it's called the Health Sciences Authority. So come back to this patient, she asked me, after taking the medicine, I've been having more hair loss. So the question to ask is, do you have hair loss before? Can we quantify the hair loss? Actually, technically, there's a method, but it's not easy. When we stop the medicine, the hair loss slow down. Again, it may take weeks or even months for the hair to come back. And also how a patient feel about hair loss is subjective. There's objective way to measure, but it's quite complex. And after that, we should restart the patient on the same medicine. We call it re-challenge to see if the patient has the same hair loss again. And this drug has to be well known to cause hair loss, and we exclude other causes. Hair loss can be caused by many causes: lack of sleep, stress, deficiency of a mineral or vitamin, of a trace element, etc. So to sum up, I explained to the patient, it's quite difficult to confirm or ascertain if the PPI I gave you caused hair loss. I did a literature search and there was no firm conclusion. So I told her that better not, but as a principle, if a patient doesn't need a medicine, we try not to give. And if the patient has some adverse effect after the medicine, we may not be able to ascertain if this is a drug-induced problem. If the drug is not life-threatening and there's alternative, then it'll be logical to switch the patient another medicine. For this particular patient, I told her that, well, there are actually now two classes of axis suppressant, the proton pump inhibitor and the we call it PCAP, potassium, I forgot the PCAP. So I told her that I will stop you from PPI, give you a PCAP, another class of medication, and see how we go. To sum up, to a certain drug-induced injury is very difficult. It's a process. As a rule of thumb, if the side effect is severe, then you just switch another drug to be sure. But to ascertain the confirmation, quite tough. This is Dr. Desmond White.